I'm here to present is Dr. Dzebic. Did not say that name correctly, but you'll get it. Dr. Dzebic is a research director at Entro, an experimental design firm where we apply cognitive neuroscience to understand how people perceive, navigate, and emotionally engage with the built environment. His work explores the intersection of behavioral science and environmental design using tools like AI, machine learning, eye tracking, and user simulation to inform more intuitive, inclusive, and human transit systems. And without further ado, I'll let him take the stage. That's his awesome work.
Okay, hi everybody. You can't get rid of me that easy, no. Okay, so we're going to shift gears, or I suppose I'm going to shift gears a little bit, and I'm going to talk a bit about human experience. Right? There was a question earlier about how we measure and quantify human experience. Came on in your presentation, one of the kind of threads was that during that long chain of design and technology, at some point there's a person involved. Right? So that's what we're going to try to get at today, and I'm going to share some of the lessons learned, some of the ways that we're applying technology in AI to try to better understand human experience. So the basic kind of theme of what I'm going to be talking about today is that from eye tracking and brainwaves to user simulations in AI, we aim to design better places by understanding human experience through technology. How can we measure experience that we can design better? And I'm going to read from my notepad here because Mary Claire, I wrote this down from your talk, and said, if you don't measure it, how can you improve it? So that's what we're going to try to do today. Improve human experience by using technology and AI to design better. Okay. So what does that look like? So here's a quick little video, hopefully it'll play, of an eye tracking assessment, right? That little yellow dot is showing you where somebody's looking at within the environment. That little squiggly line at the top is measuring a person's psychophysiology, okay? So these sort of tools and technologies have been around for a while, but now due to AI and just the improvement of technologies, they're becoming a lot easier to apply, they're becoming a lot cheaper to apply, and they're becoming more accessible for us in the design profession. A little bit of background of who we are. So I'm from an experiential design firm called Entro. So we're about 90 interdisciplinary experts, ranging fields from architects to cognitive neuroscientists. So I'm a cognitive neuroscientist on the team. We have a couple other cognitive scientists on the team as well. Fundamentally, like probably most of you, our work kind of straddles two different worlds. One is allowing people to understand how to interact with the environment, how to use it functionally and behaviorally, but then beyond that, how to connect with it on an emotional level, right? So environments that are not only efficient, but that are also emotionally resonant and impactful. Now, within our world, it translates into a lot of signage, wayfinding, placemaking interventions, graphic interventions, brand activations. But fundamentally below that, the value we really bring is understanding human experience and quantifying it and measuring it in a way that we can clearly understand what the design criteria are, what the client needs are, and then beyond there, what the human and end user needs and expectations are within the environment. So work in a range of sectors across the world, including a lot of aviation work, such as Changi at their Terminal 5. In Singapore, Australian museums, so a lot of work between cultural and public spaces. And then Roosevelt Island, more public and municipal wayfinding experience strategy program. But before I worked on beautiful projects like these, I worked in this beautiful building. So I guess the cat's out of the bag. I've actually been holding two secrets today. One is that I'm Canadian, the other one is that I'm not a designer or architect. So please don't hold that against me. So I spent about I don't even want to admit how long it's been. I spent too long in this building working on my master's and my PhD. And fundamentally, my research was on how the design effort, how design spaces and environments affect people's cognition and behavior. And why does it matter? Well, it matters because when you get it wrong, you're going to create terrible experiences. So somebody here thought at one point, oh, great, I created this beautiful arched walkway. People are going to love that, right? Guess what? Nobody wants to walk that arched walkway. They just cut straight across. So you can't beat human nature. So what we're trying to do is to understand human nature so we can design better. Now, fundamentally, what is experience, right? We toss it around, and I just want to give you kind of a bit of a background on how we think about it that'll help frame some of the subsequent conversation and presentation. So human experience is composed of, I guess, three very interrelated concepts. It's how people think, behave, and feel, right? These things interact with each other, right? So if you think something looks beautiful, you're going to engage more with it, it's going to lead a positive emotional response, right? So it's an interplay, this really complex ballet between these elements, which we're trying to influence when we design. Now, beyond that, those things themselves are shaped by two separate factors. They're shaped by the sensory present. The sensory present is what you as designers design, right? There are textures, lines, colors, contours, so on and so forth that you put into the environment, right? It's the tools within your design toolkit. But beyond that, the person comes with their own stored impressions. That's their own individual psychology, which is a result of education, their upbringing, all the things they've experienced, right? And our experience is a result of both what you design as design professionals and then the person that's within that environment. So it's a combination of those two that shapes our experiences. I'll give you a little demo of what I mean by that. Demo is this. Who's seen this? Does anybody see? I guess let me ask you this. Does anybody see anything in this? Don't say it out loud. You're ruining it. But yes, there's a dog here, right? If you haven't seen it, okay. Now, if you haven't seen it a second ago, now you'll definitely continue to see it, right? What I'm getting at here is that the perceptual present was those field of black shapes. That hasn't changed, but what's changed is your understanding that there's something in there, right? What's changed is your stored impression, right? So thus your experiences are composed of both the stored impressions and the perceptual present that you're experiencing. Now, remember that because that'll be relevant when I talk about some of the AI models we built in a second. So what experiences can we measure? We can measure a couple things. We can measure how the environment makes you think and feel. So I'm going to talk about an AI tool we built here, as well as an application of brainwave technologies. Does it capture your attention? We're going to talk about eye tracking. I kind of gave you a little bit of preview of that earlier. And then finally, how does it shape your behavior? So you're looking at some techniques and technologies to measure how people will move or how the geometry of space will affect people's reactions and behaviors. So the first tool is something we call AIA, which is an empathetic AI model that we built. So it's a custom-built machine learning and computer vision model, and what it does is it quantifies certain parameters of your experience, and I'll talk about what those are in a second. But what's happening here is in this walkthrough, as you walk through, the model or the algorithm is predicting visual complexity. Okay, visual complexity is one of the things it predicts, and I'll talk in a second about what it predicts and why those things are important. The idea is you feed it images or videos, and it gives you metrics and quantifies certain parts of the experience that we care about from a design profession. Okay, so how does it work? It's composed of two parts. One is computer vision algorithms. Another one is the machine learning models that we built. Fundamentally, why this matters is that computer vision allows us to capture the sensory presence, so it allows us to quantify what's in the environment, right? It quantifies the parameters within the space, the colors, lines, edges, contours, all those visual elements that are within the world. The machine learning algorithm that we built allows us to mimic the stored impressions, right? It mimics how people react to those sensory present, those visual parameters, because we built the models off of real human data, right? So we train these models to mimic what a real person would experience based on the data we collected and the algorithms we built. So how it works is you take an environment, take photos of the environment, you feed it into the algorithm, and it spits out predicted experience, okay? What does it measure? So it measures complexity. So complexity from a human experience psychology standpoint is what's known as a primary cognitive appraisal. So it's one of the primary kind of cognitive judgments we make of an environment. Is it simple or is it complex? Order is another one, right? Is it ordered or disordered, right? And these two things obviously interact with each other. And then from an emotional standpoint, what we measure is we measure pleasantness, which is like a basic valence response. Is it good or bad? Do I like it or do I not like it? And then there's something known as physiological arousal, which is, does it bring my energy level down or does it bring my energy level up, right? So physiological arousal and pleasantness are seen as the building blocks of more complex emotions. So for example, feelings of excitement are a result of high pleasantness and also high physiological arousal, right? Excitement feels good, feels exciting. So valence, from a valence standpoint, it's positive, but it also elevates your physiology, right? It brings your heart rate up, you sweat a little bit. So thus, by combining those two, we can get more complex emotional measures and emotional kind of metrics. Okay, so I'm gonna show you two demos here. One is a fun one is a project-specific demo. And I'm a little bit hesitant to show this demo in a room full of architects and designers, but let's go for it. So who can tell me who these gentlemen are? One was on the screen earlier today. Okay, so, Gaudi and Mies van der Rohe, right? So, Gaudi is the gentleman on the left and Mies is the gentleman on the right. Now, why do I bring these gentlemen up? For the fact that, even from my late perspective, they are very different when it comes to their architectural style and how they design, right? I think from a subjective standpoint, one is much more ornate, the other one is much less ornate, let's just put it that way. So, the question is, what would our algorithm tell us from a complexity measure if we ran a bunch of Mies buildings through it and a bunch of Gaudi buildings through it? So, you can see strategically that it's not labeled here. Anybody want to guess which one is Gaudi and which one is Mies? in the front row. I think you know, right? Gaudi, much more visually complex than Mies van der Rohe, right? That's a bit of a silly example, but it tells us the algorithm is doing something, we're making predictions which are consistent with our subjective responses and experiences. Now, as I mentioned before, and then he changes conversation a little bit, right? So you can have a bit of a different conversation because you can attach metrics to these sorts of things, right? So Gaudi is 58.6% more complex than Mies van der Rohe, right? So when we apply to some projects, the conversation we have with our client shifts a little bit, right? It's not just about, hey, trust us, but it's like, hey, we can quantify some of the things that we might care about. Okay, I mentioned before that you can combine these things to get more complex reactions, right? So excitement is up in that top corner, which I said before is high pleasantness and high physiological arousal. So Gaudi sits up over here, kind of in the exciting quadrant. Mies sits a little bit down here, in the disengaged quadrant, right? Again, physiologically, or should I say, experientially, we're trying to quantify how these architectural styles and options differ from each other. And what does it mean for our actual work? So as I mentioned before, a lot of our work is placemaking, wayfinding, and signage programs. So it allows us to compare between design options or compare or demonstrate the efficacy of our design solutions as compared to baseline conditions, right? So on the left-hand side, we have the existing environment. This is at Minneapolis-St. Paul Airport. On the right-hand side is our design solution. And what we see if you go through a series of, I believe, there we go. A series of different locations, our proposed option reduces complexity. All right, from this standpoint, complexity is valuable for us because in large, complex public spaces, you want to decrease complexity, which correlates or predicts how intuitive or how easy to navigate will be to the environment will be to navigate. So, redesign reduces complexity to locations. From a pleasantness standpoint, it also results in an environment which is perceived or expected to be more pleasant. So it also increases pleasantness. And once again, we change the conversation we can have with the client. It's 46% less complex, but also 53% more pleasant, right? In this example, I showed within kind of our world, looking at signage and wayfinding, but we apply this across a variety of different project types. It doesn't have to be signage and wayfinding. It could be any kind of design option when you're comparing two solutions or two scenarios or two schemes. All right, brain waves. Brains have been mentioned a ton today, which I love as a cognitive neuroscientist. Brainwaves allow us to tell us what how we think and how we feel. Fundamentally, all of our experiences start at the brain, or I guess maybe the body, if I can be more accurate. But if we can measure the brain, we can make predictions and quantify people's reactions and experiences. One of the most simplest techniques is electroencephalography, which is a headset that you wear and measures electrical activity at the level of the scalp. Right, so your brain works through neurochemical electrical signals. So you can actually measure that with a kind of cap that somebody wears. Different frequencies or different brainwave patterns tell us different things, right? So anybody want to guess which one is when you're sleeping? Yeah, Melvin's got it, right? So you can predict things such as when you're meditating, when you're kind of concentrating and really focused, when you're relaxing, you're calm, when memory or sensory motor processes are occurring, and then finally when you're sleeping. Right. So the idea, and we've done some initial testing in the lab at the offices, you put a headset on a person and you let them view a series of design options, right? You can even have them go through a physical real-world environment or a video walkthrough. You measure their brainwave activities, and then you look at, well, what's the difference between this and this? How does it shape your brain, and how do we extrapolate or predict what the experience will be like, okay? Unfortunately, I don't have too much data to share on this. We actually have a project with our transit agency, which we're getting up off the ground. So if you'll have, maybe I'll come back next year and just do a talk on that. But a quick little demo of what the data might tell us is that big drop like right after the zero, that's happening when there's unpredictable stimuli. So when you look at something, you don't know what the task is, you don't know what you're expected to do, right? So you're a little bit confused, like, what am I supposed to do here? And this occurs when somebody's looking at this space, right? Because you're kind of looking at it like, okay, am I supposed to make a phone call? Why are you showing me this, right? There's nothing there for you to interact or engage with. So these are the sort of tidbits of information we'll be able to pull from this data and allows us to, once again, tap into where experience starts, if we're being honest. Okay. Next, eye tracking. So one of the big things we ask ourselves is, does it capture your attention, right? So we design things, we put them in the environment, and we hope people will notice them and they'll interpret the information we present. But We don't know necessarily, right? We know that real-world environments are really, really complex. There's a lot going on, right? So it's useful for us to figure out what is capturing your attention. Because if it captures your attention, it's going to drive your experiences, right? We don't want to put things in the environment that aren't going to do the job they're intended to do, right? So from us, from a placemaking, wayfinding, and brand activation standpoint, if you put something in the environment that doesn't capture your attention, then it might as well not be there. All right, you can generate really cool heat maps. I know everybody loves a good heat map. So this is a heat map showing the eye trace or the eye pattern, gaze pattern on this little demo within a mall setting. This is what the headset looks like. It's called a pupil neon headset. This sort of stuff 10 years ago was only available in lab settings, but as I said, due to improvements in AI technology, these sorts of things have become much more accessible and are much easier to interpret than they were as well, which makes the deployment a lot easier and a lot quicker. I know it looks kind of scary, but it's so simple that even babies wear it, which is kind of wild. Look at that. Okay, so here's a little video that we did on a little demo project, a little kind of proof of concept place. All right, let's see. There we go. So this is somebody walking through Union Station in Toronto. And again, it's capturing where they're looking, right? What environmental features are capturing their attention and which aren't capturing their attention. You'll see that yellow pylon is doing some serious lifting. They were staring at that pylon like their life depended on it. And what you also notice is that they're not actually looking a lot at the environment here, right? I think what it's telling us is that in complex spaces and complex scenarios, what people end up looking at is other people, right? So in an interesting way, a lot of what environmental design could be is almost creating vessels for experience, right? People are engaging with each other in these environments rather than necessarily directly engaging with the environment itself, right? And I'm not totally sure what to do with that because I feel like it's a bit of a shift in how we as a design firm think sometimes, right? Where we think our design is the key thing within this experience, but in reality, other people using that environment and how the end user interacts with others within the space might be more fundamental in shaping the experience than anything else. And then, as I said, the pylon, there it is. Right? So, a little demo or a quick little case study of how we apply that on a project. This is from a hospital in Toronto, actually called Sunnybrook Health Systems. And what we had is a scenario like this. It's I'm not sure. Thankfully, I haven't been to a hospital here in the States, but it's pretty much what all of our hospitals in Canada look like, right? It's messy. There's lots of stuff all over the place. And what happens is people look at the things you don't want them to look at, right? They're looking at the garbage can, they're looking at the bookshelf, so on and so forth, right? So for us, it's how can we improve this experience from a wayfinding standpoint, right? We knew that one of the critical pieces of information here is that people weren't able to find the G-wing doors, right? So our strategy was, or what we were trying to solve for is, how do we guide people to the G-wing? And what we created were two scenarios with slightly different color options based on some feedback we received from the client, right? And what we see is that there are some significant differences between those two. Primarily that the example on the left-hand side with the, burgundy door captures much more of your attention than with the pink condition, right? So the client was actually pushing for a two-color strategy, but what this suggests to us is from an attention capture standpoint, having a single color strategy with a red door, that red burgundy door at the end, is going to actually have the better or the more positive patient experience because their eye will be guided down that hall, thus they'll be more likely to find the G-wing doors. It also allows us to see, this is kind of like a probability that people will notice the information. And as you can see on the left-hand side, the majority of the attention capture is through that series of information, including the large G-wing signage, the overhead sign, and the door as well, right? So it allows us to evaluate what people's attentional experiences will be like across a variety of scenarios. And again, we can quantify some of these things, right? So we demonstrated that within the red door scenario that there's 90% less visual surge, so your eyes aren't darting around as much, instead you're going to the critical piece of information of the environment. And it's also 39% faster to detect the door, right? So we're quantifying the improvements to the overall wayfinding patient experience. Okay, and then the last item I'm going to cover here is how does it shape your behavior? Okay, and I'm going to talk about two tools, or two techniques here. First is something known as space syntax. Some of you might be familiar with this, but what space syntax is it uses the geometry of the space to predict people's behaviors, right? One way to think about it is that a room that has a very large open geometry is going to be experienced much differently than a room that has a very narrow geometry, right? Another way to think about it is that think like a river network, right? The large, more broader rivers are going to have much more water flowing through them than the narrow kind of tributaries and so on, right? So it applies these sort of principles to quantify over 90 different parameters within the environment. And the research demonstrates that these parameters predict certain types of experiences, right? So one, for example, is something known as integration. So the more integrated a location is, the more likely people will naturally move through that location, right? And obviously from a wayfinding and navigation standpoint, or just a general kind of user journey standpoint, these sorts of parameters matter and are useful. So two scenarios here with that central kind of courtyard area on one of our projects with an airport client. And you run through these two scenarios, and you get, again, a heat map. Like I said, everybody loves the heat map. And what you see is that there are some differences in the patterns here. This is integration, right? So the image on the right-hand side is, let's say, hotter. There's more integration in that area. It's not a huge amount. It's only a 5% improvement of integration. But if you think about the fact that there's thousands of people walking through the space, the fact that it's more integrated means that there'll be kind of an additive effect as people navigate and more naturally find their way through the space. And fundamentally, this area is intended to be a kind of main gathering spot. So we want integration or the overall connectivity to the site as a whole to be as high as it possibly can. So here we can quantify and look at different scenarios and make a recommendation based on the data, based on the evidence we've collected. And the final technique is pedestrian flow simulation, which again, some of you might be familiar with. It's slightly different where you model a space and then you release virtual agents, right? You give those virtual agents certain tasks. You can change the parameters of how those agents move, the speed that they move, whether it's a single person or multiple people move through the space, whether they need to find a bathroom or heading straight to their gate, if it's let's say an airport setting, so on and so forth. And then you kind of release them into the wild. So I don't know if you can see it from where you are, but just bunch of little dots moving around, right? So this allows us to kind of quantify where the patterns of movement are, what are the most active corridors of paths of transit, where are the hot spots, where are the bottlenecks. And then we can suggest design solutions to either support the paths of travel that we see, or also to modify some of the paths of travel if, for example, we want to relieve one of the bottlenecks that the modeling is demonstrated for us. So in this example, Concourse C on the right-hand side, there isn't open yet. And then what we were able to do is model another scenario where Concourse E, excuse me, I might have said C, Concourse E now is open. So how does that change the patterns of movement through space, and how do we support that change from a wayfinding and navigation standpoint? And then obviously we make recommendations to our clients in order what the data demonstrates or the data show. And again, we can quantify some of these things, right? So in this particular example, there's an increase in passenger density by 23%. So we're moving passengers 23% more through the space based on the two conditions or the two scenarios. Okay, so I was gonna wrap it up at this point, but poor Erica had to update my presentation during lunch due to some of the conversations I was seeing, right? And I think one of the conversations I heard came on during your presentation. Somebody asked about how do we measure reactions or responses in the environment, right? What sensors might exist or either now or in the future to quantify people's experiences, right? So a lot of technologies that I talked about are things that are like wearables, right? So eye tracking headset that you wear, or an EEG headset, or a Fitbit that you might wear. But I was at CES in Las Vegas with a colleague, and one of the trends that I kind of spotted was that a lot of these sensors and sensing technologies are entering the physical world, right? So perceiving and thinking environments, it's no longer AI within your devices, but now it's AI that's going to be in the environment, right? And it's going to be able to monitor and potentially track you and predict your reactions within a physical environment. You can have a bit of a two-way conversation between yourself and space. What does it mean like? It's like webcams that can measure where you are, how you're moving. They can even measure some of your emotional states, right? So this technology here is a webcam that measures your emotional reactions within the environment. Now, it's going to open up a lot of ethical questions and concerns, but it also opens up a lot of doorways for how design might change. And it's no longer just a one-way conversation. It's a two-way conversation between the person and the environment. So if we want to design for people, we need to replace opinion with evidence. That's kind of the big news. And AI and technological advancements are allowing us to do that more. I guess finally, all hail Pylon, and thank you very much. On the screen is a white paper we published recently describing all these techniques and demoing them and showing case studies of their application.
I have a question. In the slide that you show for the Sunnybrook Medical Center, that it had a like 89%, 19%, is that measuring the the percentage of the people you tested looking at that or is it the intensity of registration in their brain?
Yeah, so that was a prediction based on the visual properties of the environment.
Oh,
right? So
okay.
based on the data collected and based on the techniques you're using, the technology you're using, it makes a prediction of how likely certain features will be noticed, right? So that percentage was, the higher percentage it is, the more likely it'll be noticed by somebody walking.
I mean, also that yellow pylon, when they were looking, like I saw that blue circles and red circles,
Yes.
is that just by, so what does I mean, there's a looking and there's a registering in your
Yes.
brain what you're looking at,
Yeah.
right? That gets tracked differently in neuroscience.
Yeah,
Is
yeah.
there, what is the difference between the blue circles and red circles
Sure,
that
so
we're
the blue
looking at?
circles in that video, red circle is where you're looking at that particular moment in time. So it's, for example, red eye, red circle would be at your face. The blue circles are the previous fixation points, right? So for example, now look at this gentleman right here, Craig. So the blue, this red circle that was on your face second will turn blue. So it's like a historic trace of where
Oh,
you're
I
looking. So the last you see in sequence, what's the first, second, third, fourth, fifth, and so on thing that you notice. You'll see in the recording, there's actually, I'm not sure if it was visible from the audience, but there's a number beside the blue circles. Each number is one up in sequence. Each number does like every fixation. That's it's like 700, 701, 702. That's actually the sequence.
Do we have a way to record what gets registered into their
yeah,
brain or no?
That's a really good question. So I think what the research will show is two things. One, if you fixate on it, so if you put your foveal vision, so your central vision onto it, chances are good that more likely than not it's going to register, right?
Registered memory.
We also have instances of, for example, like, we've all like daydreamed, right? Where you're kind of staring off into the distance. Technically your eyes are looking out somewhere there, but you're not.
It's not registered.
Exactly, right? But I think it's safe to say that people that have a task demand, meaning that they're trying to do something within the environment, if their eyes are fixating on something, you can assume, I think it's a fair assumption that they're registering, that information is registering, that they're attuning to it, as you would say, right? Now, the interesting part is that I feel like I'm just going on and on about this, but the interesting part is that peripheral vision also does matter, right? Peripheral vision captures your attention really, really quickly. So quickly, like the thing that popped into my head when I was sitting there, I kept glancing over at the screen over here. Because every time it would change, I was like, oh, what's going on over there, right? Even though I wasn't fixating or focusing my attention onto the screen, peripheral vision is really good at capturing movement within your periphery. That's kind of what it evolved for, right? So a lot of our reactions are, at least to a certain extent, as a result of our peripheral vision. There you go.
Sure, thank you. How much of the data that you get from this research is, or I guess, can you give us some examples of things that were surprising evidence that you found? And I ask that because it seems like a lot of the results would be confirmation of what you would assume, right?
Sure.
Especially if there's, design professionals involved, people who are experts in graphics and wayfinding. I think any of us could look at some of the photos and be like, this is obviously clear, right?
Yeah, Aaron, you're spot on, right? And I think, I'll be honest with you, I'm pleasantly surprised how often our designers get it right. You know what I mean? And I think that's why you're design professionals, and that's where experience and expertise comes into play, right? So you're spot on about that. I think it's two things. The first is that, as I mentioned a few times, is that even though we get it, sometimes the client doesn't get it, right? So it allows us to have a bit of a different conversation and convince them in a way that they're not relying on our opinions or expertise, even though more often than not they're valid, right? So
It's backup for what
it's
you're
backup,
doing.
but I can off the top of my head think of two examples where, for example, the eye track in particular told us things that were novel or unintuitive, right? So the first is, I guess one is more novel than the other, but I'll mention them both. The first one was one of our transit projects. Within our fields, there is a tendency to put signage that's near stairs, kind of close to the stairs, right? It's either like right as you enter the stair or maybe just a little bit further back, right? And I guess it makes sense. It's close to where you're supposed to be going down. You're trying to kind of create a proper sequence of events. One thing we noticed right off the bat is that best practice was actually not good practice, because what happens is when somebody starts going downstairs, they look down so they don't fall down. So that information above them is completely missed out. Right? Another example was another transit project, different transit client. We had a map that was showing system disruptions, right? So one of the lines was closed. That was communicated in two ways. Actually, I think in that instance, it was only communicated in one way, which is a big yellow band up top talking about the disruption, right? What we noticed is that people didn't look at the yellow band. What they looked at was the system map. So the system map was, and again, it's maybe not so intuitive because I think there's from human psychology, we know that people preference visual content over written content, right? But that's something that our design team and the other designers within the team, within the kind of larger consultants team, wouldn't have known unless the data actually demonstrated it to us, right? That the written language, which was in bright yellow up top, didn't capture attention as much as we would expect it to capture attention.
Fascinating. Have you looked at all at what's happening with, if you look into the future with these augmented reality headset displays coming online in glasses, and if those can help us interact with the environment and get us to doorway 8, for example, that you were showing. That's one question. Another question I thought was fascinating was the yellow cone and the people who are obviously looking for a friend or foe or danger or as we're moving through an environment. There's also a temporal aspect to that too, right? It's late at night versus in the middle of the day versus during a party. What are we looking for? So late at night, you probably would be looking much closer to people's faces, which their trajectory is. So where is this future of the augmented glasses in your studies? I can see an intersection that I think is.
Yeah, so like wearables and augmented tech, I mean, I think it seems quite kind of obvious where the journey path would be. I think at the end of the day, there's still going to be information design challenges to be solved, right? Just because you can display information on a headset doesn't mean that it's going to be useful or meaningful information to somebody, right? So in that sense, there's always going to be a role for, as a design professional, to figure out what information is required and how to present that information, right? One kind of example is that, one way to think about it perhaps is that human navigation and wayfinding, although we're all used to like blue dot technology now, like information that shows you on your Google Maps, like point by point locations, we as humans don't actually navigate that in unfamiliar environments, right? We use more of a kind of landmark decision node based system, right? So the reason I'm bringing that up is that just because technology can give you blue dot technology or blue dot positioning might not actually be consistent or useful from a kind of experience or navigational standpoint. So I guess what I'm getting at is that just because the technology exists doesn't mean that user experience challenges won't be there to be solved. If anything, they have to be solved for us to get it right, right? And the second piece is like environmental or contextual differences in how they shape your experiences, if I can maybe paraphrase that way, like nighttime conditions versus daytime conditions. So yeah, 100%, I think it's the diversity experiences what we're trying to design for. We try to create something that's going to work optimally the most amount of time, but it's going to be conditions where certain things, certain factors change that we might not expect, or that we need to be maybe a little bit more knowledgeable or a little bit more thoughtful in addressing. So it reminds me actually, I saw a quick study showing where women and men look when they're navigating a dark kind of pathway. Men look directly straight ahead, for the women, their gaze is all around, right? Because they feel unsafe and they're scanning for dangers within the environment. So these sort of factors exist across a variety of domains and experience types.
One question right here.
Yeah, I was wondering if you can share some example or thoughts about how you work with your design team to bridge what you research with the design process. What is the feedback loop? What is the framework of bringing in all those data into a strategic plan for the design?
It's a great question. I think it's probably the most critical part of all this, right? Because from my standpoint, the data we collect is only as good as it actually impacts strategy, right? So I think there's two main branches. One is, we're brought in doing like discovery. We do a quick little engagement. We come up with like a quick summary, and then the design team creates like a project mandate out of that, and then they just run with it. What we're shifting more and more towards is having a much more extensive strategy and discovery phase, where we apply, for example, all these projects in 3-4 month long engagement, and then what we develop from that is a strategic document where we clearly outline, based on specific locations or specific experience types, exactly what's needed from a design standpoint, right? So what products are needed where, what those products should look like, what the products need to respond to within the environment. So we kind of stipulate a series of outcomes that the designers need to hit, or a series of parameters the designers need to hit when they move through the design phase. And then part of it is that the client side, the client team is also there, so they're aware of what these recommendations are and what the design team needs to achieve as to work from strategy to design development. Great.
Do we have any data available for the
geriatric population with mental health degeneration, because when we design the housing for senior housing with mental health issues, there's a disconnect between the caretaker and the patients, right? And nobody knows what's the best practice yet.
Yeah.
No one has, I mean, the doctors have their own assumptions, designers have their own assumptions, and no one really knows what the best practice is.
Yeah.
So I'm thinking this would be incredibly useful data if we can test both populations
Sure.
and see what would be the best solution for designing the right environment for the
Agreed.
caretaker and the senior
Agreed.
population.
Agreed. We're currently working on a seniors emergency medicine center, right? So it's getting at some of the questions you're getting at. Unfortunately, we didn't do any of these. We didn't use any of these techniques, but more kind of like desk research and figuring out what the existing research demonstrates is useful from a design standpoint. For example, the application of colors, themes and concepts, those sorts of kind of environmental psychological principles and parameters. But you're spot on that you could conceivably use these techniques to look at, I guess, difference between populations and how you can design effectively to meet the experience of both of those populations. That's great.
I think we have time for two more. Okay. We have one over right here. Do we have one?
How do you determine if the data is for general versus skewed in one direction or another?
Yeah, so I'm just trying to get a sense of when you say skewed, what do you mean by skewed?
I mean, if you had just a few people, let's say, walking through a space, they might have one point of view, but
Sure.
the general public might have.
Yes, it's a great point. I get your question now. So yeah, it's something that, there's ways that you minimize it in research. So one of the ways you do it is just by having large enough sample size for these studies, right? So you're not running 2 people, you're running 20, 30, 40 people, right? And the other piece is just converging pieces of evidence, right? So ideally you're applying a lot, if not most of these techniques and technologies together, so they kind of build off of each other, right? And then obviously I didn't talk about it here, but this is kind of like our R&D technologies piece, but we do the typical research methods as well, workshops, focus groups, online surveys, we talk to, the core client team and the end users and so on, right? So the idea is that when you combine these pieces of evidence, you get as honest or truthful impression of what the experience is like. Acknowledging that there's always going to be outliers, right? And there's always going to be people that are going to have experience that you didn't expect or predict for, and you have to find ways to try to account for those people as well. And some of that is obviously following kind of accessibility best practices, let's say, right? So you can design for people that might have accessibility needs that might not be captured with kind of more typical individuals.
Great. We have one last question here.
Yeah, I wanted to ask about the ethics of some sort of,
I'm looking all the way back over there. Where's this voice coming from?
I'd love to see the little,
Yeah, oh my God. I got some of
The
them.
yellow dot.
Yeah.
So architects have the duty of care to protect, the health and safety of the public. I really appreciate the possibilities for accessibility for this sort of data. I can also see how it can be leveraged for a variety of things, from more efficient advertising, which is benign but not great, to some really nefarious things. And I just wanted to see how ethics kind of plays into your practice.
It's a great question. Where's Sean? Sean and I were having a conversation about this earlier, right? The idea that, yes, I can definitely see as somebody looking at the presentation from a world different than from I'm from could extrapolate it to exactly where you went to, Nick, right? So I guess for us, it's 2 things. One is that we're not an advertising marketing agency. That's not our role. That's not what we care about. What we care about is creating experiences and creating emotionally resonant and efficient experiences, right? So that's our purpose of collecting the data, right? So fundamentally, it's as simple as that in one way. And then I think beyond that as well, it's when we work with our clients, we maintain kind of ethics standards from our standpoint, but also we work with them to figure out what is the most appropriate and ethical way to collect the data and to make sure that is secure and anonymous and so on, right? So, for example, the work we did at Sunnybrook, right? We're working with a healthcare facility, right? So there's a lot of ethics concerns and privacy concerns there. So we work with their ethics teams and their ethics boards to make sure that everything is being run and the data is being collected in a way that is ethical and secure and safe.
one last question.
Let's go.
Well, actually two. So the
I
pylon.
don't know if we have time for two. What's good?
Sorry. I'm just really curious. This is a
Can I
fascinating.
get three? Can I get three? Okay, yeah.
So the pylon, do you think it would have been as attractive to look at if it wasn't for the two like
Guys
security
looking at it?
guards
Yeah, yeah.
like standing around it?
That's a great point. You're probably right. You're
Yeah.
probably right. Like, you know, it's like, if we all stand, like, I think there's a name for the effect. It's like a conformance effect of some sort, right?
Yeah.
So, it's a good question. It probably wouldn't be as attention capturing, right? There's two
Right.
things going on. One, it's a pylon that's unexpected. It's not supposed to be there, so automatically it's going to capture your attention. And I think you're right. People looking at it is going to draw your attention to it as well.
And then is there like since you're interviewing the client to see like where these friction points are, and especially for like airports, right? Are you like doing exit interviews from the people that are wearing the goggles to kind of see
Yes.
if they're just
Yeah.
not just
Yeah. So it's a good point, and it's all these physiological or kind of measurement techniques like eye tracking and these skin conductance measures. Whenever you're measuring something, you need to add a subjective experiential component to it as well. What I mean by that, for example, is let's take heart rate. Your heart rate increases, but that could be for a variety of reasons. It could be because you're scared. It could be because you're excited. It could be because who knows what, right? So just measuring, for example, where people are looking isn't going to tell us the whole story, right? So we need to also interview them and question about what that experience is like so we can tie those two pieces of evidence together.
perfect? Thank you for
Of course,
accommodating.
my pleasure, my pleasure. Okay, thanks everybody.
Okay.